Hey, everybody. Welcome to Candidly Unapologetic with therapist Jen. This is your 15 minutes of candid discussion about mental health that will invite you to question traditional treatment practices and will always leave you with a holistic nugget to better your own mental health. So today I want to talk about psychotropic medication. And I can guarantee that I have a lot of listeners out there that are taking some form of psychotropic medication. And really, truly, the spirit behind today's podcast is to give you some information and to leave you thinking about how your medication journey, if you want to call it, started that way. And as a field, how we got to this space and why the hell it is that as a licensed professional counselor and somebody who worked within the mental health field for 13 years actively, even with a very large treatment team, there was so much emphasis always put on medications. And I'm going to share a little bit with you about where I started with meds and what I'm trying to do to get big pharma out of my life. So that is a lot to fit into 15 minutes here, but we're going to do it today. So I want to talk quickly about 5 main types of psychotropic medications. So for those of you who are listening, are you taking any antidepressants, anti-anxiety meds, stimulants, antipsychotics, mood stabilizers? Okay, those are pretty much our big 5 psychotropic meds, okay? I'm going to tell you a little bit about where my introduction to this started and where I am today. Now, when I was probably about 18 years old, so we're going to do a little math. I'm going to say that's at least 20, 22 years, maybe a little bit more depending on when I started. So now y'all are going to know how old I am. Holy shit, that was a long time ago. I went into who was my OBGYN at the time. And I was struggling with symptoms of depression. And she had said to me, you know, Jen, I think we should start you on an antidepressant. It might help a little bit. I had some support even from my mom, who's a very holistic kind of chick, and at the same time needed to manage on medications as well to get her through certain times of her life. Okay, so I said to the doctor, well, yeah, I mean, great. There was no other discussion for me about alternatives, okay? My treatment plan was, Jen, here's some Lexapro, and why don't you try that and take that? And for 22 years, every time I came back to my physician or even my primary, because over time, you know, you get your primary doc, they were always like, Jen, how you doing? And I say, I am great. And I would talk a little bit about my struggles and got to a point where I actually realized that there was a pattern with me. And I would take less medication during the summer months and go back to my normal dose during the winter months. So I knew for myself there was something seasonal to this, and November would come and I'd be like, shit, this is Wisconsin. It sucks. And the next 6 months are going to blow. So I need something to help my mood. And I would go back up to my normal dose, and then I'd hit about April and May and be able to go back down. Started doing that myself. Got to a point where I, as a patient, was not being completely honest with my physicians either. And took me years till I finally said that to them. Okay, so anyways, getting off of that track, I basically am saying to you guys, for 22 years, I maintained myself on this dose of Lexapro, and it's a smaller dose, but I'd go up and I'd go down. And there were times where I would have to go up because circumstances in my life would dictate I needed more because I was struggling. And then there were times where I would go down. And for years in my practice as a counselor, I brought that to the table all the time with my patients. Yes, I'd be holistic in terms of treatment methods, but I would say, are you taking medications? Are you willing to consider them? Here's the benefits of them. I look back on my education, my 8 years almost, it took me almost 8 years to do school. Most people could do a little bit quicker, but you know, I decided to take some paths to get some more psychological assessment courses and essentially had to retake some classes. But that journey for me, and all that time, I looked back at my frickin' transcripts, and do I see any classes that were on anything other than good old standard psychodynamic, cognitive behavioral, trauma treatment interventions, right? All of these things that psychology taught me. Was there anything about alternative treatments? there was. And those alternative treatments in my curriculums were, you guessed it, psychiatric medication, talking about psychotropic meds, right? The SSRIs, the SNRIs. But there wasn't a damn thing about, oh, I don't know, neurotransmitters as it relates to food. Okay. And so it really, I look back and it sucks because I'm like, shit, I did my patients a disservice when I was working in all those years as a therapist in corrections. I always brought exercise and some nutrition into things, but I never brought it like I could have. So I want to go and tell everybody here right now that in today's episode, I want you to start questioning if you are taking any SSRIs or any SNRIs. I want you to think about the messages that I'm talking about today. So for those of you who may be taking medications but don't have a good understanding of what that is, okay, that's okay. Let's talk about this. So SSRIs are our serotonin and norepinephrine reuptake inhibitors, right? Those are the SSRIs and the SNRIs. I kind of mix them together. Those are two of the most common medications that are used to treat depression, anxiety, like OCD related disorders. They essentially, in a nutshell, are reuptake inhibitors, right? Okay. And these medications, essentially what they do is they work by increasing levels of our brain chemicals, which are neurotransmitters. Okay. Neurotransmitters' role is, in a nutshell, again, I'm going to give you Reader's Digest. They communicate signals between our nerve cells in our brain, our neurons, right? So SSRIs are going to block the reuptake of serotonin, okay? They're the first choice oftentimes. I mean, I don't want to say first choice because I am not a medication prescriber, but they're often a choice prescribed for depression and anxiety. And so SSRIs are your Celexas, your Lexapros, your Luvox, your Paxil, your Prozac, your Zoloft, all that good jazz, okay? Then there's your SNRIs, okay? Your serotonin, norepinephrine reuptake inhibitors. And those block the uptake of serotonin and norepinephrine. Okay, so here's your little science 101 for the day if you're excited and talking about like the brain piece of this. And okay, so for those of you taking some medications, SNRIs might be your Cymbaltas, your Effexors, your Pristiques, things like that. Okay, so I look back on my curriculum throughout all of my schooling and went, why the hell was there an emphasis on this? Which this was in there, right? Along with all of the other classes that I took, but there was nothing on how do I look at neurotransmitters from a stance other than psychotropic medications. Okay, why is that? All right, so as a provider, I am going to preach what I learn, especially when I'm naive and I'm new in the field, right? And so absolutely, I'm going to take a stance on not going to medications to deal with mood symptoms, right? And anxiety and depression, things like that, psychiatric disorders. And at the same time, I am also going to consider that and mention that to my patients because I was working with some of the most mentally ill patients that were in the state that were confined within the correctional setting. So I did not have the knowledge and I didn't do enough work to bring more of that knowledge in. So that is where I failed myself and my patients in both ways as a provider. So here I am now, years later, going, why am I still taking all of these medications? Now, for many of you, I want you to ask yourself how many times within your medication journey, and I hate that word journey, so someone listening, please give me a different word. I want to say hustle because that's just what I'm going to call it right now, the medication hustle, right? On and off, on and off, on and off. How many of you did that? How many of you went back to your doctor and did a check-in, whether it was a medical doctor? If you were like me, it might have been an OB that prescribed something because you were much younger, whether it was a family medicine doctor, whether you are seeing a psychiatrist. How many times did you go back and all they asked was about your symptoms? Should we go up? Should we go down? Now I want to know how many times you went back and they said, you know, you're having these side effects, right? Let's put another medication on that. And I know damn well there's many of you out there going, yep, that's me. Yes, that's me. Yes, that's me. Now what I want you to do is I want you to think about how many times you went there and the prescription given to you was, you know what? Let's look at something different. Instead of the medications you're taking, let's look at your lifestyle. Let's look at how much you exercise. Let's look at the food you are eating. Let's look at your sleep patterns. How many times was that part of your treatment plan? That shit was not part of your treatment plan. And if it was, I want you to go back to your physician the next time you see that doctor and tell them thank you. Because this is what we're going to talk about today. Food affects brain functioning. And if you do not believe what I am saying, I'm going to give you some resources at the end of this to start looking up. Okay. What we eat matters. What we eat affects our mood. What we eat affects our neurotransmitters, which is exactly what these medications are doing that you are taking. So let's talk a little bit about this. Neurotransmitters, right? These are these chemicals in your brain that help regulate mood, behavior, other psychological processes, okay? And there are certain foods that actually affect the production of neurotransmitters in your brain, which is what these medications are doing. So I am going to speak generally about this, and there's going to be people out there, Jen, oh, you're missing so much. There's all these other confounding variables that you are not talking about. Yeah, I know that, which is why you need to start doing the research. And each one of us you're going to have opinions on this. Okay, good. I want you to walk away and be pissed at me. I was just featured on a podcast not too long ago, Tea Time with the Psychos. You have got to check these girls out. They are just so awesome. And I said to them, my podcast, I want people to walk away and I want you to be inquisitive. And I want that inquisition from you. And I want you to be pissed at the same time. So we are inquisitive and we are pissed. We are inquist. I want you to walk away and quist. Okay. I want you to think about this idea that food affects brain functioning. I'm going to talk about an example here. If you eat protein-rich foods that are going to reduce some of those levels, okay, of serotonin and increase some dopamine and norepinephrine in the brain, this is a thing. Fish has omega-3, okay? It affects your brain function. It is going to affect the production of your neurotransmitters, okay? And the number of neurotransmitters that are produced. Raw pumpkin. We could talk about spinach, all kinds of seeds, raw almonds, seeds. Let's go. Sesame, sunflower, pumpkin, turnip greens, buckwheat, millet. I can go on and on. Let's talk about dates and oats. The list goes on. That list that I just pulled right off the top of my head, these are all awesome neurotransmitting producing foods. Okay. So I want you to think about what you eat. And all of those things that I just listed off, okay, are those foods that are in your diet, okay? Are you eating salmon? Are you eating any chicken? Are you eating whole grains? Because guess what? Whole grains have complex carbs, and that's going to lead to some glucose that's going to be produced and give you some source of energy. Okay, the chicken is going to help you with mood and depression. It helps produce serotonin. Avocados, okay, spinach. It fights off insomnia. Sleep is something I talk with my patients about all the time because it's got folic acids in it, okay? The nuts that I just mentioned, okay? It's going to help provide some oxygen to the brain. It's going to give you some magnesium. Like I said, those are omega-3s, and that is a direct link to fighting depression, okay? So then, of course, my favorite, which is the dark chocolate. You've got to get on that dark chocolate train. It's so freaking hard because what am I going to say? 85% cocoa or more is what you need for those great antioxidants, but it's going to help boost your attention and your memory. And all my friends out there who have issues with ADHD, memory, concentration, hyperactivity, all those types of things, this is where you start, is things like this. So this is a very simplistic form of me talking about this with everybody here. But I am telling you, if you look at what you are feeding your brain, it is going to work on changing the game for you. So here is my nugget of information, and I'm going to give you just a couple resources to go to, okay? My nugget of information for everybody here is that the next time you are in by your doctor, ask them for a treatment plan that involves foods that boost your mental health. And if you get this blank stare from your doctors, I'm sorry, but frickin' be ready for it, because you might. Or if you get this glossed over kind of answer on, well, you could start to look at this or this, and it's not nearly as detailed as this last 5 minutes of mood food that I gave you, go farther. Be an empowered patient. I myself have 22 years into trying to figure out how to get off of one antidepressant and what it is going to take for me after years and years of trying and even assistance from my doctors after I was truthful about, what I was doing with my own changing in doses. Okay. Even when doing that, I have tried 6 times that I can count to go off and I couldn't do it. The piece I was missing was a lifestyle change looking at what I eat. And that is the piece I didn't have. So I want to challenge you when you go in the next time to ask that question. And if you get that stare, then I want you to start looking up some resources and I want you to be that empowered patient. What do you need? I want you to look up Dr. Drew Ramsey. I want you to look up Dr. Tara Linsell. I want you to read the book called The Better Brain. I want you to read a book called The Antidepressant Solution. Look these things up and start to educate yourself. And if you get done listening to me and you are like, there is no way this chick is making any sense, start doing your research. I'm telling you, it will change the game for you. And so that's your nugget. So what I want you to do today is I want you to think about what you're feeding your brain. I want you to check out my YouTube channel. It's right where this podcast is at Candid Empowered Energy. Look at the videos that I post. You are what you eat, so don't eat crap. Take that dose of Candid Empowered Energy and make things happen.